Hello, I am Dr. Olena Berezovska, and today I want to address a topic that affects every woman at some point in her life: menopause. While it is a natural transition, menopause is often misunderstood and surrounded by controversy, particularly when it comes to treatment options. For years, hormone therapy has been debated with concerns about safety, effectiveness, and long term health implications. However, recent research and advancements are helping us separate myths from facts and offering new solutions to improve women's quality of life during this phase. Let's explore the latest updates, clear up common misconceptions, and discuss what the future holds for managing menopause effectively. One of the most debated topics in menopause is hormone replacement therapy, HRT. The term hormone replacement therapy, HRT, has largely been replaced by menopausal hormone therapy, MHT, in medical literature and clinical practice. This change reflects a more accurate understanding of the therapy's purpose. Instead of replacing hormones to premenopausal levels, MHT is designed to manage the symptoms of menopause and support health during this life stage by supplementing hormones to alleviate the effects of their natural decline. For decades, MHT was the standard approach for alleviating menopausal symptoms such as hot flashes, night sweats, and vaginal dryness. However, the publication of the 2002 Women's Health Initiative WHI study significantly altered public perception. This study reported an association between MHT and increased risks of breast cancer, heart disease, and stroke, causing many women and healthcare providers to abandon it altogether. Later analyses of the WHI data revealed a more nuanced picture, showing that the risks vary depending on a woman's age, the timing of MHT initiation, and the type of hormones used. For instance, initiating MHT within 10 years of menopause or before the age of 60 may provide cardiovascular benefits rather than harm. Despite these findings, the lingering fear from the initial study continues to influence decisions, highlighting the need for better communication and education about the safety of modern MHT. The use of bioidentical hormones has also become a contentious issue. Marketed as natural alternatives to conventional MHT, bioidentical hormones have gained popularity, particularly through compounding pharmacies. While proponents argue that these hormones are more closely matched to a woman's natural hormone levels, critics point out that compounded bioidentical hormones are often unregulated and lack standardized dosing and quality control. Ongoing research aims to determine whether bioidentical hormones offer superior safety or efficacy compared to FDA approved MHT options. Until then, the lack of robust evidence remains a significant barrier to their widespread acceptance within the medical community. Non hormonal treatments for menopause have emerged as alternatives for women who cannot or do not wish to use MHT. Options such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are increasingly prescribed for managing hot flashes and mood swings. Complementary therapies, including phytoestrogens, black cohosh, and acupuncture, have also gained attention. It is important to understand that the term phytoestrogens can be misleading. These compounds are not estrogens in the direct sense, like human hormones. They are not synthesized in the human body and do not perform the functions of endogenous estrogens. Their mechanism of action is indirect. These compounds can partially bind to estrogen receptors, ER alpha and ER beta, inducing weak effects that depend on their concentration and the surrounding environment. The action of phytoestrogens is significantly weaker. They exhibit activity that's thousands of times less potent compared to the estrogens produced by the female body. Therefore, it would be more accurate to refer to them not as plant estrogens, but as estrogen like compounds or phytochemical modulators of estrogen receptors to avoid confusion. However, the evidence supporting these alternatives varies widely. While some studies suggest benefits, others indicate limited or inconsistent effectiveness. This lack of consensus adds to the challenge of providing clear guidance to women seeking relief from menopausal symptoms. Beyond treatments, menopause is often stigmatized, with cultural taboos and societal expectations discouraging open discussions. Many women feel isolated or embarrassed about their symptoms, leading to delays in seeking care or accepting effective treatments. This stigma underscores the importance of education and open dialogue to empower women and normalize conversations about menopause. On the positive side, advances in science and medicine are revolutionizing how menopause is managed. Personalized medicine, driven by advancements in genomics, is helping tailor treatments to individual needs. For example, genetic testing can identify women at higher risk of conditions like breast cancer, guiding more informed decisions about HRT. New therapies are also emerging, offering hope for women who cannot use hormones. Neurokinin 3 receptor antagonists such as fezolineton are gaining attention for their ability to manage hot flashes without relying on estrogen. Similarly, non hormonal vaginal estrogen alternatives are being developed to address genitourinary syndrome of menopause, GSM, providing relief from symptoms like vaginal dryness and discomfort during intercourse. Lifestyle interventions are another crucial area of focus. Research continues to underscore the role of diet, exercise, and stress management in alleviating menopausal symptoms and promoting long term health. For instance, regular weight bearing exercise helps maintain bone density, reducing the risk of osteoporosis. Emerging technologies, including wearable devices and mobile apps, are making it easier for women to track their symptoms and receive personalized recommendations, bridging the gap between science and daily life. Menopause also serves as a critical window of opportunity for preventing chronic diseases. As estrogen levels decline, women face increased risks of osteoporosis, cardiovascular disease, and cognitive decline. Proactive measures such as bone density monitoring, cardiovascular assessments, and psychoactive health strategies can mitigate these risks, ensuring better long term outcomes. Menopause is not an end, it is a new chapter in a woman's life. As science evolves, we are learning how to manage its challenges with greater precision and compassion. Whether through menopausal hormone therapy, MHT, non hormonal alternatives, or lifestyle changes, women now have access to more options than ever before. But to truly benefit, it's essential to stay informed and work closely with healthcare providers to find a personalized approach that suits your needs. Thank you for joining me today to discuss this important topic. Together, by embracing the latest knowledge and breaking the silence around menopause, we can make this transition not just manageable but empowering. I'm Dr. Olena Berezovska, and I hope this information inspires you to take control of your health and well being. If you like this video, please press like and write your comment. Stay tuned for more discussions on women's health and wellness.